Hello, I'm Terrence Alfred Anderson, and this is Health Watch. The Centers for Disease Control and Prevention defines body mass index, the BMI, as a number calculated from a person's weight and height that provides a reliable indicator of body fatness for most people and is used to screen for weight categories that may lead to health problems. You can calculate your own or your child's BMI by visiting the CDC website at www.cdc.gov/healthy weight/assessing/BMI. There you can enter your own height and weight in either metric or American measurements and then do your own calculation. But in 2011, as well as last year, the Eastern Virginia Medical School partnered with a number of agencies throughout Hampton Roads to conduct BMI measurements on kindergartners, third graders, fifth graders, seventh graders, and 10th graders in multiple communities. The Norfolk Department of Public Health conducted assessments in the Norfolk Public School system, both in 2011 and in 2013, reaching over 20,000 school children during both versions of the project. We gathered important statistical data that likely closely mirrors numbers from other Hampton Roads cities, while still being uniquely Norfolk data. I served as a team leader on both editions of the Norfolk component of the BMI project, and I have brought on board other key players who will help me better explain the project, visit how it came into being, discuss why it was necessary, review a brief snapshot of the findings, and take a quick look at projected outcomes. We will also reflect on the daily practical implementation of the project, the insight gained, the challenges, and the rewards. First up is Norfolk District Epidemiologist Michelle Burnett, who served as the project manager for both editions of the Norfolk BMI project. Next up is Nakia Goforth, an epidemiology health counselor for the Norfolk Department of Public Health and a newcomer to the BMI project. Lastly, but certainly not at all the least, is Tom Russell, a frequent volunteer with the Norfolk Medical Reserve Corps, who, like many MRC volunteers on this project, worked numerous hours to ensure its completion. Welcome to Health Watch, guys.
Thank you.
I'm so delighted to have all of you on board. Michelle, what can you tell us about how the Norfolk Department of Public Health got involved in the BMI project?
Well, Terrence, there was a lot of mutual interest in the community around childhood obesity, and we partnered with Eastern Virginia Medical School and the Norfolk Public School System to measure students in grades kindergarten, 3rd, 5th, 7th, and 10th. In that, we measured about 10,000 students. Participation in the project was voluntary, and we were able to gain some local level data that we didn't have before.
And we did about 10,000 students per version of the BMI project in
Correct.
2011 and 2013.
Yes.
What kind of other agencies were involved beyond the Norfolk Department of Public Health? You mentioned EVMS shepherded the program, but what other kind of agencies?
Well, with EVMS, there are other localities that have participated in the project. Portsmouth has participated in the project, and communities on the Eastern Shore have also participated in the project.
And were these all health department agencies? For the most part, they were.
Yes.
Okay. In the implementation of the project, were there any agencies that assisted each other in implementation in their own jurisdiction, in their own district?
Well, I can tell you that in Norfolk, we primarily focused on the public schools within our city. But for technical, as a technical resource in sharing the BMI machines, we worked with the Portsmouth Health Department. They had done the project before, and we worked with them on some technical troubleshooting issues that we came across.
And as I recall, EVMS provided someone to come to several of the schools on occasion as well.
They did.
Before we get into really painting a comprehensive portrait of the project, let's discuss the bare nuts and bolts. How is the BMI calculated? I know it's a very scientific kind of thing here, but in layman's terms, what is that formula?
Well, it's really a simple calculation using height and weight. And if you're unsure about your math, you can always visit you mentioned the CDC website earlier, and there are lots of other websites where you can just plug in your height and weight, and it will calculate the number for you. But it's a simple calculation using your height and weight.
I think it's probably obvious, but I'd like your thoughts on why you deem this is such an important project for us to become involved in.
Childhood obesity is a major public health issue. With obesity, there have been associations with chronic health conditions, mental health issues, poor school performance, and it was really important to see what do Norfolk's children look like? What is the weight status of Norfolk's children? We know what the national picture looks like and the state level picture looks like, but we really don't know what Norfolk's looks like.
Now, you've kind of alluded to this already, but when addressing obesity and people being overweight in the community, what role does the BMI actually play, and how does that work?
The BMI really is just a piece of the puzzle. It's really just part of the picture that we can use to assess a child's health. And it's just a quick screening tool that we use.
Pretty effective one, too.
Yes.
Nakia, you were a team leader with me and Anthony Pettiford.
Yes.
What did you find most insightful about doing the project?
Well, like you said, I was a newcomer to the project, but I thought it was really interesting how through this data we were able to get a snapshot of the Norfolk Public School age children about their BMI and the different ways, just speaking with Michelle and also one of the EPI supervisor, Norm Grieve, about how we could implement the data from this, you know, being any kind of policies to change exercise or diet in the elementary schools, or just, you know, using it to communicate with the parents about, you know, different things they can do.
Do you recall any particularly memorable moments? There was always something new and exciting and different, huh?
The students probably made the entire experience most memorable, particularly the kindergarten students. First trying to talk with them about what was happening. They were really concerned. They didn't know if they were going to be getting a shot because, I mean, they just came in with just big eyes like, what's going to happen? And then also explaining to them what the BMI machine was and just their characteristics, their attitudes. It was absolutely interesting experience.
So we did kindergartners, third graders, fifth graders, seventh graders, and 10th graders. Were there any distinct differences? You mentioned kindergartners, but were there any distinct differences by age or by class and how children reacted to the project?
And how they reacted, we got the biggest reaction, like I said, from the kindergarten students. As we kind of went up, the students were mostly pretty much indifferent. I can say what I expected as far as data-wise. I did expect to see the data skewed for possibly a higher average BMI. With the higher age groups, we tend to have more control over their diet, and being that there are a lot of vending machines in the schools that we saw, they would be more apt to grab something out, like some chips or a soda out of the soda machine. Versus with the younger age groups who eat what is being given to them. So that will primarily be, you know, whatever's in the school cafeteria, and we know that that generally is a more healthy diet, but actually just from looking at the raw data, there really wasn't any kind of correlation between age group and BMI that I saw. The data wasn't skewed in either direction. It was pretty evenly distributed. So that was interesting just to see, just from what my hypothesis was, you know, this being my first time and going into it and actually getting the snapshot of the data.
What do you think was the greatest challenge as a team leader and as one actually doing the BMIs?
Other than loading the equipment every day.
It helped to keep you in shape.
It did. It really did. Honestly, the entire project, it just worked like a well-oiled machine. All the teams worked very well together. We got just enormous support and cooperation from the school staff and the faculty and even the students. They were really excited about it, as well as we had parent volunteers. So honestly, I really can't name any other difficulties. It really ran well, and honestly, I'm looking forward to the next time we do this project.
Well, Tom, you're one of my absolutely most favorite people, and I'm anxious to chat with you about your own perspective of the BMI project. But tell us about the Medical Reserve Corps. How long have you been involved with the Medical Reserve Corps? What is the Medical Reserve Corps? And why do you volunteer?
Why do I volunteer? I retired from the government service after 38 years, and it's time to give back to the community. I've got the time. I've got the income, and I enjoy doing it. The Medical Reserve Corps is one of the Citizens Corps agencies that was formed after 9/11. It's run out of the Office of the Surgeon General of the United States. And we're a team of medical and non-medical volunteers. I'm a non-medical volunteer, so I'm more of a pick it up here and put it down there and take notes and run the computer and that kind of stuff.
That's because you're a jack of all trades. You can
Well,
do basically
yeah,
everything.
yeah, sort of. I'm an engineer, so I do a lot of different kind of stuff. But we have nurses, we have LPNs, RNs, we have a few doctors, we have a veterinarian to serve in emergencies, in a community-wide or regional-wide response. We also have been filling in, helping the health department on various projects like this one. This one was not an emergency response, but some of the things that we are doing are practice for emergencies.
Indeed.
So TDAP programs in the schools, other projects like that.
What other kind of projects have you specifically worked on, you personally, through the MRC?
Well, I was a painted up victim at a active shooter drill at Harbor Park, where they painted me with blood running down my face and evacuated me at gunpoint, you know, this kind of stuff. That was fun. TDAPs in the schools, the BMI project. I've been running the ready room at the health department, so when things are needed, just be able to grab it and go.
Like I said, you were a jack of all trade, and a lot of folks don't know this, but Tom is one heck of a cook, particularly when it comes to baking. He brought something for us to sample a little bit later on. I want to talk about your perspective as a volunteer on the BMI project, but what I'd like to do is to take a little bit of a break now, and when we come back, we can pick up that conversation with your own perspective. And guys, I want to thank you all for joining us today. Didn't I tell you it was going to be great fun?
Thanks, Terrence.
Get real excited. No amens. We're going to take a bit of a break right now, and when we come back, we're going to find out a little bit more about the BMI project. Stay tuned to Health Watch.
Clean kitchen surfaces, utensils, and hands with soapy water. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Welcome back. We're talking about the BMI project, the Body Mass Index project conducted by the Norfolk Department of Public Health and the Norfolk Public School System. When we were last chatting, we were talking to Mr. Tom Russell, a volunteer with the MRC. And you worked on that project as a volunteer. What insight did you gain from working on that project?
After the first day, which was confusion for me, I started thinking about it.
I have a lot of days like that, Tom.
No, okay. We might have been too late, because the pattern, as Nakia mentioned, didn't seem to change through the years. Mm-hmm. So I'm thinking that we probably need to start earlier in age for good eating habits, good exercise, and good parental involvement. Mm-hmm. By the time they get to the public schools, lifetime patterns seem to have set in, and then the patterns seem to have just kept right on going, right on through 10th grade, and probably right on out into adulthood.
Yeah, I'm sure EVMS has taken a lot of that in consideration. They probably did a fair amount of research to determine the best demographic profile to target with this particular project. I do, in fact, hear what you're saying. That said, I'd be very interested in knowing if you saw or experienced any particularly memorable moments. I know the kids were a joy. I loved working with those kids, particularly the kindergartners.
Oh, they were so much fun. The kindergartners come in, and they line up and they sit down where the teacher tells them to, and they take their shoes off, ready for the machine, and some of them are a little scared, and some of them come up, and Nakia was asking their name, and he says, "Little Willie." And she says, "What's your last name?" Okay. It's something that hadn't been asked often enough for to be a response.
some of the 10th graders seem responded the same way, right?
Yeah,
Would
but-
not speak out very loud. Did you make any differences? Now we're talking about kindergartners and 10th graders. Did you notice any differences yourself in the age range and how the kids participated in the program?
How they participated in the program.
Or any difference at all related to the age and the age difference?
Yes. Of course, by the time you get to middle school, the kids have a lot of excess energy, a lot more excess energy. Nakia and I walked into a gym getting ready to set up, and we heard a whistle, and all of a sudden we look like that, and there's a herd of kids running full tilt towards us. And we're just wondering what in the world is going on
That
here.
had to be pretty scary.
And the kids were running one end of it, touched the wall and go back, and we didn't know that. We had no idea we were being sacrificed or something. You know? But it was interesting because the kids had a lot of energy, and it was important in the schools enough to devote the time for them to have an exercise period during the day. I think it was a little wet outside or something, so they were doing it in the gym.
We did a couple of those in a gym
Yeah.
setting.
Yeah.
Michelle, I talked earlier about the weight status categories. Can you elaborate on that, please, as well as the percentile rankings?
Sure. When a child's BMI is measured, we need to be mindful of their gender and their age. It's not a straight calculation like we would do or interpret as we would for an adult. So for children, when the BMI is calculated, that measurement is plotted on a CDC BMI for age growth chart, which is specific for boys or girls. And in doing that, what we account for is the child's gender and their age. We know that body fat changes as we get older, and then there's a difference in body fat between boys and girls as well. And so that's why it's important to account for those factors in measuring a child's BMI and their relative weight status category. So the BMI is then translated into a percentile and then a weight status category. And those weight status categories are underweight, healthy weight, overweight, or obese, with underweight being less than 5%, healthy weight between the 5th percentile and the 85th percentile, overweight between 85th and 95th, and obese greater than or equal to the 95th percentile.
I see. Nakia, as you know, you guys know I was going to try and get a machine here. I wasn't really able to do that. But so in the absence of a machine, let's talk exactly how it works. And, you know, the viewers are looking at one of the boards up on the screen now, and they can see the machine on the right-hand side of the screen. But so you step up on the machine, take it from there.
Okay, so you would take your shoes off, as well as also if they.
That's why I forgot to bring the machine.
Oh, okay. So you wouldn't have to take your shoes off.
Let's take off my shoes or my jacket, or see my BMI.
Oh, so we would have the students take their shoes off, as well as any heavy jackets or coats that could add weight and possibly skew the data, and basically stand facing forward and look straight ahead. It's really important to also stand still, but stand straight and looking ahead, because there's a sensor at the top, and it's measuring the top of your head. So if the student or someone stepping on the BMI scale is looking down, the sensor is going to hit the vertebra, and it's going to incorrectly measure their height. And basically, you stand there, you hear some beeps and some clicks, and then just from weighing you and also measuring your height, the machine calculates your BMI, shows up right on the dial in front, and it takes a couple of seconds.
Yeah, it just takes a couple of seconds indeed. The other thing I wanted to ask, we've talked about being overweight, and we talked about obesity and the health consequences, but there are other health risk factors that come to play that can affect things like heart disease and et cetera. Can you tell us about some of those? I mean, like beginning with hypertension.
Oh, absolutely. Well, like we said, even though our project primarily focused on, you know, BMI and school-age children, like Tom was saying, we're starting to see how this trend of unhealthy lifestyle behavior can be carrying over into adulthood. So things like hypertension, like you were saying, high blood pressure, imbalance of your cholesterol. You're having a low HDL and a high LDL, and those are supposed to be reversed. Also, unmanaged blood sugar or blood glucose, family history of any chronic diseases or hypertension. Also, cigarette smoking, primarily sedentary lifestyle or lower physical activity, all of those things can put you at higher risk for chronic diseases that are 100% preventable, excuse me, but hard to, well, actually not even hard to manage, but it's going to throw an extra hurdle in your life if you have to manage something that is 100% preventable that you can do without medicine on your own.
How about it? Let's talk a little bit about the findings that we've gathered thus far. You know, what kind of statistical data have we gleaned thus far from doing the project?
From the 2011 project, we found in the students that we measured, about 44% were either overweight or obese. And that is that was relatively consistent across the grades, like we had mentioned before.
Right.
So fairly consistent between the kindergarten, 3rd, 5th, 7th, and 10th graders. And that 44% is above state and national level data, which is around 31, 32%.
That's pretty pervasive incidence of this is overweight, not so much obesity. Obviously, obesity is included in those numbers, but this 44%.
Right, the 44% is combined of overweight and obese.
Okay, what about the outcomes, specifically in Eastern Virginia? You know, we've done this BMI project now, and has it influenced some change at all?
It's gotten the attention of a lot of people, and it's important to remember, you know, as we mentioned, this project was conducted in Norfolk and Portsmouth on the Eastern Shore and some other localities as well, and so people are interested in it. You know, we know that childhood obesity is an issue, but we really haven't quantified it. We haven't put a number on it yet, and I feel like it isn't until we've quantified the issue that we're able to really address it. And so it has the attention of local leaders. There have been some assessments and improvements done to try to address childhood obesity, improvements for walkability and bikeability in communities. There's a lot of interest in community gardens. There have been stairwell challenge campaigns to encourage people to take the stairs instead of the elevator. So it's really just kind of changing the way that we think and incorporating exercise and everything that we do every day, and then also making the healthy choice the easy choice. So, you know, instead of grabbing a bag of chips to go with your sandwich, grab an apple or a banana to go with your sandwich.
You know, that's something I really need to do. I think that there's a direct path, worn-out path, a beaten path from my desk to the vending machines. That said, tell us, Nakia, about Rev Your Bev.
Oh, okay. Rev Your Bev campaign, that's actually something I helped out with our health promotions, and it was an initiative that we had basically to educate Norfolk citizens and even everyone at the health department about how many grams of sugar were in a lot of the beverages that we drink, from sports drinks that are supposed to be healthy for you, the protein or vitamin waters, even getting to the energy drinks. And it's all in an effort to increase healthy lifestyle behaviors and get people to drink more water.
Okay. Tom, we mentioned the Norfolk Medical Reserve Corps. You've been a volunteer with the Medical Reserve Corps for how long now?
3 years.
3 years. There are likely to be a number of viewers out there who have an interest in volunteering with the Norfolk Medical Reserve Corps.
Great.
Can you give them some contact information, please?
Yes, the easiest, of course, is email, which would be Norfolk MRC at vdh.virginia.gov. And the other phone would be 757-683-2760.
Beautiful. We want to thank you for all that you do with the Norfolk Medical Reserve Corps and all the volunteers with the MRC. And very quickly, can you tell us, in a nutshell, what does the Office of Epidemiology do?
It's a great place to work. So, epidemiology, if you think about it, really is kind of like being a disease detective. We investigate disease outbreaks, we follow up on reports of communicable diseases, and we're really looking to find out the who, what, when, where, why, and how, putting all those pieces together to prevent disease transmission in our community.
And what is the contact number for the Office of Epidemiology?
The best number to reach us is 683-2800.
683-2800. Any quick comments in the final closing moments about your experience with the BMI project? Again, for me, I really, truly love working with the kids. It made the day go by pretty quickly. Yes, sir, very quickly.
I think we need to get through to the parents and start young.
Start yelling.
Start young.
Start young. Okay.
Start
I was going
young.
to say yelling. You would do that, Tom. wouldn't you?
No, we don't yell at
Okay.
kids. That's pointless.
But I'm talking about to the parents.
Right.
That's starting young, absolutely.
Starting young.
Yes. Well, guys, I want to thank you so very much for coming on to the show today. Didn't I tell you be quick and painless? I'm the one that always goes through the most pain. Thank you so very much.
Thank you.
And of course, I want to thank you for watching Health Watch. You can see previous editions of Health Watch online at www.norfolk.gov/Health Watch. If you'd like to drop me a line, you can email me at terrence.afra-anderson@vdh.virginia.gov. Please also feel free to give me a call at 757-683-8836. That's 757-683-8836. For the Norfolk Department of Public Health, I'm Terrence Afra-Anderson, and this has been Health Watch.